All right, hello and welcome everybody to today's workshop. I welcome you on this wonderful Sunday. Hope you're having a great day and you're relaxing, enjoying yourself, and maybe you're sitting out by the pool and it's springtime where you're at and you're just watching this on your cell phone. That would be wonderful for you. Or maybe you're already retired or looking to retire sometime soon and you saw the topic of healthcare, and that may be one of the biggest things that is holding you back. So what we have for you today I think is going to be very, very good for you and very interesting. We have the first video in our series about healthcare. So it's going to be a bunch of videos that we pre-record and I'm going to share with you here on Sundays at 2 o'clock that are going to walk you through all the different aspects of healthcare. So I appreciate you showing up today. And for those of you that don't know me, my name is Jason Hamilton. I'm a chartered retirement planning counselor and the admin of this group, right? So I come in here and try to help you guys out when it comes to planning for retirement and answer as many questions as I can. So if you're new here, definitely introduce yourself. We welcome you. We would love to answer your questions and help you out here. We have a wonderful community of thousands of people looking to retire, and this is a good place to come in and ask questions and get some answers. So before we jump in today, there's something I wanted to chat about a little bit and just share with you an experience I had recently. And this is really for those of people that are trying to do retirement all on their own, right? Without the advice of a professional. So what I want to share with you is that I've been working out, going to the gym now for probably over 20 years, okay? And so I've taken classes on working out. I've read, at least a dozen different books on all kinds of different exercises. I've read Arnold Schwarzenegger's book. I've taken classes on nutrition. And so I know a decent amount, about working out and exercising and nutrition, right? But even though I've been working out for 20 years, lately, actually not really lately, probably for the past year or two, I've had this pain in my lower back that no matter how much I stretch, no matter how much I try to work on it and do different exercises and try to get rid of it, I've done research on the internet, I've watched a bunch of movies or I should say movies, but a bunch of short videos on YouTube trying to figure this out, but I cannot get rid of this throbbing back pain. So finally last week, I have just got a little bit fed up and said, you know what? I need to invest in my health because, being healthy and exercising is something that's really important to me personally. And so those are the type of things I think you should invest in, right? And so I went to the gym that I'm at, 24 Hour Fitness, and I went and talked to the manager there. And I said, hey, who is a specialist here in lower back pain that can help me get rid of these things that are bugging me, right? And so I, met a trainer, got introduced to a trainer. Come to find out, she's, a little bit over half my age, or barely under half my age. And normally I would think, that person wouldn't really be able to help me, right? So they're a lot younger than I am. They have a lot less life experience. But what I found out is they had a certification specifically in helping people with lower back pain, right? So even though I don't want to pay for help because I've been doing this for 20 years and I think I know a lot about it, and I've been, again, learning and doing a lot of research on my own, doing everything that I could on my own, what I came to find out was I spent the first 20 minutes of my first session describing where the pain was happening, what type of exercises I'm doing, everything that I've been trying. And what I've come to, what I come to find out is she said, okay, hold on. She came back and she got this one tool, right? And it's this little it's kind of like a massage sphere, like massage ball thing. And she said, okay, do this exercise. Put it right here and roll up and down on your lower back and your upper gluteus and do it this way and move it over about 2 inches, roll on it that way for 45 seconds, and then go side to side for 45 seconds and then switch sides. So I did that, and then I did some stretches she recommended for me, and lo and behold, after 2 years, I got through a workout and I don't have that same pain anymore, right? So that was just our first session. So how I'm relating that back to when it comes to your retirement is I want you to really think about, are you the right person to help yourself, right? Are you the professional, and can you get everything right on your own? Or are you going to sit there and choose to try to figure it out, suffer, and possibly miss something that if you had someone in your corner helping you out, you would be able to get it instantly, and in a matter of weeks or months, you could be solving problems that have been frustrating you for possibly years. So again, just want to share that with you. I hope that is coming in okay. And I'm seeing some people saying that they can't see the video or the sound, but I'm also hearing other people saying that it is going okay. So if there's anything that you can't hear, if this is not coming through, let me know, because I'm going to play the video in a second. So if you can please confirm with me that everything is good on your side, that everything has come through clearly, I would appreciate that. So again, just quickly, even though you may think you know a lot about something, unless you're doing it every single day, for example, like I am as a chartered retirement planning counselor, all I do really is specialize in retirement planning. So I've seen the same situation hundreds of times, maybe 1,000 times in certain situations. Same thing with this trainer. She's seen people that have the same problem in the same area a bunch of times, and so she knew exactly where to target and how to get my problem fixed. And so that's what I essentially do as a planner, is help people get their problems fixed, right? So that's I just wanted to share that quick little parable, because I really see that a lot of times here, that people are worried about investing and thinking that it's going to be a cost to them to get assistance on their retirement, when in reality it's probably an investment, and it's going to either make you back multiples of what you invested into it by getting the right advice on taxes, on Social Security, on your pension, on your investments, or it's going to save you a bunch of time, which at the end of the day, time is money as well, versus trying to figure it out yourself. So thought I'd share that with you. I'm hearing the sound, everything is good with the sound. So I'm going to play, I'm going to cue up this video here for us that hopefully we can see. And so this video is going to be the first in a series, like I said, from our good friend Malia, who's really my specialist when it comes to getting medical insurance in place, because as you know, that could be one of the biggest expenses if you get it wrong, especially in early retirement. But even with Medicare, getting the wrong Medicare plan could cost you $3,000 to $5,000 additional a year until you're able to fix it, which there's a delay once you sign up. So if you're in early retirement, this series is going to be so crucial for you, and I think it's going to be really helpful. So I'm glad you're here, and I appreciate you guys tuning in to watch. So let me cue up this video here. And today we're going to talk about marketplace versus private place plans, and I'm going to have Malia show you this video, and then I'll quickly summarize once we wrap up, but I hopefully you enjoy it here. Let's play this video.
Hi, thanks for tuning in. Today, we're going to be discussing the differences between marketplace plans, otherwise known as Obamacare or ACA plans, versus private plans or alternative plans. The reason why it's important to understand the differences is because at some point, you or a loved one will be shopping for insurance, and with so many different options out there, it can be confusing what you're signing up for. So by the end of this video, you should be able to spot the differences and also know which questions to ask prior to enrolling. So the first difference you're going to notice is in premiums. If you don't qualify for a tax credit, in general, marketplace plans are going to be 20 to 50% higher than private plan options. Also note that if you do qualify for a tax credit, you will not be able to apply them to private plans. You can only apply tax credits to marketplace plans. The next difference to note is in network coverages. In most states, your marketplace plans will only cover you in state, and in fact, some states only offer HMOs on their marketplace. If you're buying from a private plan, most likely you'll have a nationwide network, and so as long as you stay in network, it won't matter if you're a California resident seeking treatment in Texas or your own state, your out-of-pocket costs should be the same. The other difference is enrollment periods. In most states, you can only apply for coverage during open enrollment, which in most states is November 1st through December 15th, coverage starting January 1st. There are some states that extend that out a little bit, but private plans are going to be year-round enrollment. So you don't need a qualifying life-changing event in order to enroll outside of open enrollment. Marketplace plans, if you miss the deadline, then private plans are a good option to get you through to the next open enrollment. The next one is a huge difference. Coverage on pre-existing conditions. Marketplace plans are required by law to cover your pre-existing conditions from day one. On the other hand, private plans do not have to follow that law, and they could place a pre-existing conditions clause on there. It could be anywhere between 12 months to 24 months, but that's something you want to make sure you're aware of. And what they mean by pre-existing condition is if you've sought treatment for it, if you're taking medications for it, if you've shown any signs of symptoms prior to enrolling, that is a pre-existing condition. So here's an example. Let's just say your right knee had been bothering you the last few months. You had it checked out, you had it scanned, and the doctor says, oh, there's nothing wrong with your right knee. Well, 6 months from now, if you're on a private plan and you decide, oh, I'm going to need knee surgery on that right knee, then they can actually deny your claim because you've had knee issues prior to enrolling on that plan. The next thing you want to consider is exclusions. Marketplace plans in general, if it is a medical necessity, they will cover it. However, private plans don't have to cover everything. So there's going to be certain things such as maternity, wellness services, other things that are excluded. So you have to decide whether those exclusions are important to you or not. If you're a 25-year-old male, maternity and wellness services may not be very important to you. However, if you're in your mid-30s and you're still planning on a family, then you're going to want to make sure you have those maternity coverages. If you're in your 60s, maternity may not be important to you, but those wellness visits to cover your mammogram and your wellness colonoscopy may be important. Other exclusions may or may not be a big deal to you. Prescriptions. So marketplace plans will cover prescriptions. However, private plans will normally offer you a discount on prescriptions. If you're just taking generic, non-name brand drugs such as high blood pressure or high cholesterol meds, then these drugs are very inexpensive anyway. So that coverage may not be important to you. The last thing you want to consider is your risk tolerance. So marketplace plans are notoriously for low risk, high premiums if you don't qualify for a tax credit. And private plans are going to be more if you have a high risk tolerance, but in return, the premiums are going to be lower. So you're going to have to balance out your needs versus your budget. So in general, if you're in good health and you don't qualify for a tax credit, then private plan options may be a good option to look at. If you have a major chronic illness and you're taking name brand drugs, or you qualify for a really nice subsidy, then maybe a marketplace plan might be a better fit for you. So each person's situation is unique. Feel free to reach out to me. In the next video, I plan on discussing all the different private plan options there are out there. If you have questions, please feel free to email me at malia@customizeyourinsurance.com. Thanks for tuning in. See you next time.
All right, so did you guys find that informational? Hopefully you did. And Malia is excellent, right? She is one of the, actually probably the best for sure. I've talked to other folks and she just all around is the best as far as helping with me, because generally when folks are going into retirement and they're trying to get, say, a subsidy, for example, we need to work together to figure out, okay, where do we need to keep their income, right? So that they can qualify for the subsidy. And then what I do is I'll kind of map out their distribution strategy, that we're going to take a little bit from here and a little bit from here to make sure that the income needs are funded, but that we don't go over that barrier to make sure we miss out on our subsidy. And I was just working with the client yesterday, and it's actually really, like, for some folks, it's just so close. You have to be really, really careful when you're walking that line, because if you go over, it can easily be a $10,000 surprise when it comes to tax time. So working together to make sure you have the right type of coverage, make sure you're properly cared for when it comes to your healthcare needs. But if you can get some subsidy to qualify for the ACA plans, that's a wonderful way that can really help you retire earlier than expected. And many times I've seen folks go from $1,100 a month down to $200 a month, for example, when it comes to their health insurance costs. So really, really great to have her on my team and to work with her. And then if it comes to the private plans that we may need sometimes, like she said, those don't have those qualifying event restrictions, which may or may not benefit you as well. And of course, there's a shared plan. So those shared plans can be really useful if they're covering a gap and you need to keep the coverage reasonable for a short amount of time. So hopefully you guys enjoyed this. I really appreciate you watching, and I really appreciate you tuning in, because I hope you realize that I actually really enjoy coming here and teaching you folks and kind of showing you new things that you may not have seen before, and giving you a place to come ask questions, get information. I get a lot of joy out of that. So I appreciate you tuning in. It means a lot that your attention's here and that you trust in this group to come and help you. So if you have any questions at all, I'm going to put my link up here if you want to schedule a call and talk to me here. Oops, a little small. I'm going to make that a little bigger. If you want to chat with me and see how we could possibly help you, you can go to keepitsimplefinancial.com/talk. That goes right to my calendar page, and you can schedule a complimentary call there. And what we do from there is just really set up a 45-minute to an hour discussion to discuss sort of where you're at, when it comes to retirement planning, where you want to go, what the gaps are, and if we can help you get there, right? So we're going to talk about a lot of different things there to really make sure that you have the right information so that you're crossing that goal line to retirement with confidence. And I will give you a step-by-step game plan of all the things that I think you should be doing, at least from a high level, to make sure that you have the right plan in place. So if you need that, I'm happy to speak with you. This week is really busy, so you might not be able to get a call this week. It might pop out to the following week, but if you're looking to talk this week, give it a try. But I know this week's really packed, so appreciate you guys. So if you need anything at all, drop a comment down below. If you are watching this at a later time, beyond Sunday, at 2 p.m. or it's about 2:22 now, Pacific time and 5:22 East Coast time, just comment down below, tag Malia, tag myself if you have a question we didn't answer, and we'll be happy to hop in and do our best to get you responded to. So other than that, folks, have a great day. And then, like I said, every Sunday, Malia is going to be doing some videos for us, one a week, and we'll be releasing these on Sunday, and I'll possibly jump in and do some additional education on other things I think will tie in. So have a great afternoon. I appreciate you so much. And have a wonderful Sunday. Bye, guys. Talk to you soon. Bye-bye now.